So bodywork aims to treat primarily musculoskeletal pain, so that might include things like back pain, neck and shoulder pain, but it also includes things like sports injuries and any conditions where the body's become overloaded, because the body tends to respond with stress and tension in the tissues. One of the main focuses that I tend to use in bodywork is the myofascial layers. The myofascia is the layer of connective tissue that runs right the way through the body. It's continuous right the way through, so this means that when you do a little release in one part of the body, you can end up having an effect on tissues in other areas. The difference between bodywork and other treatments like massage or physio, osteopathy, is that your aim is to integrate the soft tissue release work and give the patient an experience of ease and comfort in their body, but also to understand what it is that's actually happening. So by understanding what's going on in that release process, they can start to integrate the ease into their life. So it's quite important to involve the neurological system, and that means that my aim is, as a bodywork practitioner, is to inform the patient about what it is I'm aiming to do, and give them the opportunity to understand how they can help themselves, how they can look after their posture, their alignment, their understanding of what's going on in their body is really very important. So education is a big part of every bodywork session. Fascia is the connective tissue layer, so we have this kind of layer in our body that wraps around our entire form, and it runs through our body but also wraps around all our muscles, all our ligaments, and it's that layer that you're looking to release. So they sometimes describe it as the organ of posture. You have the myofascial layers. The fascia is your fascial system. It was kind of ignored by anatomists originally, so there wasn't a huge amount. It was the bit, when they were doing dissections, they kind of scraped off, and it's only recently that they're doing quite a lot of research into it, and as a result there's in the sporting world, for example, they're learning the importance of, if you've got patterns where the fascia is kind of knitted up, then you lose some of the spring and the ease in your movement, and if you can release that off, then someone will move more easily and be less vulnerable to injuries. So one of the other ways that you can use bodywork is to release after someone's had a kind of sports injury. So this patient came in with hamstring tightness after hill walking. So the aim is to lengthen out the hamstring tissues. And you're not looking to kind of push the body through barriers. You're really looking to find where the body's able to move to. And then here I'm asking for the patient's feedback in terms of what they're feeling in terms of comfort. And then at that point, when we get to the point where they're as far as they can move before they feel any pain, then we ask for a contraction. And once you have that contraction, you can then move the body into a deeper state of release. So ask that in this situation here, the patient's done the contraction, and then we're looking to take the hamstring into a bit of a stretch. For this gentleman, we weren't able to take the stretch too far because the hamstrings are in quite a tight state, and so we just needed to take the release through gently. And you're not just looking to release the muscles, you're also looking to release the fascial layers. Okay, so one of the other ways that bodywork can be really helpful is when someone's developed a postural pattern. So these can come about from things like sitting at a computer for too long, or if we repeat a particular pattern in our lives, then what happens is the fascial system tends to become quite restricted and can stop you moving in ways that feel free and comfortable. So the postural alignment piece is basically about learning how you can start to move with more ease, but also learning how to look after your alignment better. When we're more aligned, we tend to be more comfortable. So sometimes the transition from a postural pattern that doesn't serve you, so where the body is flexed forward, the body can start to tighten up through the front, the tissues in the front of the body, and then leave you with kind of things like lower back pain, neck and shoulder pain. And by learning about how to hold yourself well, how to use your body and your system to support your alignment, you can start to have more comfort and ease in your day-to-day life. So what we're doing here is just trying to encourage people to find a taller spine, looking for spaciousness in between the vertebrae, sitting more comfortably. And then once we've got someone into good alignment, that's the point at which we start to do the work. So we want to give the body positive messages about what is good alignment, where do we want to be, and that's the point at which we can start to do the release. So the alignment piece, getting you comfortable before we begin any kind of treatment, is really, really important. The body relaxes when it's aligned. So this is a nice demonstration of some neck and shoulder release. Neck and shoulder is an area that tends to get pretty tight on a lot of people. And we're just looking to release the fascia here. So it's a slow sinking pressure, and then we're encouraging the patient just to put a little movement in there as well. And it's that combination of the slow releasing touch and the patient's movement which enables us to get into the tissues that are hanging on to release the tightness. But the other thing that happens when we ask for movement at the same time as releasing is the body responds on two levels. The first is just the release of having the pressure on tight tissues. The second is that the neurological system starts to understand that you're looking for ease in movement. So when you're looking over your right shoulder, are you able to look as far as you would like? Or are you hitting a point where it feels painful or tight? And if it feels painful or tight, can we do something about that to release off, to release the fascia, to release the muscles? And one of the areas that can become tight or fatigued is the spine. So in this sequence, we're aiming to lengthen out the tissues that lie either side of the spine, giving the patient a bit of room. And again, we're looking for a sinking, slow pressure. So the myofascial work is a slow connection into the tissues. And during these release works, we'll be giving patients prompts about their breathing to encourage an awareness of how they're using their breath, how they're using their body posturally. And by finding that fuller breath, the body's able to release on the exhale. And the comfort of the patient's primary right the way through. So at the beginning of any session, we'll make that really clear that your comfort is important throughout. So the patient will be giving me feedback the whole time on what they're noticing and feeling in their body. And it's that dialogue between the practitioner and patient that's really key. So you'll notice that this contact and touch is a lot slower than you'd normally expect in other treatments, and that's because the fascia takes a little while longer to release than muscles. The other key advantage of the slower pace is that when the body has the opportunity to release slowly, it doesn't respond by contracting. So if someone comes in with a deeper pressure, sometimes the body can respond by contracting in resistance to that kind of invasion of the body. And what we're doing by releasing and sinking in slowly is we give the body the opportunity to say, this is okay, I feel safe, this is comfortable, I can let you in. And then you can get in really nice and deep and get in, release all those kind of deep holding patterns without the body needing to protect.